The gentleman from Georgia, Mr. Johnson, who is recognized for 5 minutes.
Thank you, Madam Chair. Mr. Sternfels, isn't it true that since 2008, the Food and Drug Administration has paid McKinsey more than $140 million in taxpayer money?
We have been serving the Food and Drug Administration since that time, Congressman.
And you've received $140 million over that time, correct?
I don't know the exact number, but it sounds about right.
And Mr. Sternfels, isn't it also a fact that $40 million of those fees came from the FDA's Center for Drug Evaluation and Research, which oversees numerous opioid-related programs?
Congressman, I don't have the splits by program. If that's of interest, I'm happy to provide that back to the committee.
Sure. But I mean, you won't disagree with the fact that your firm, McKinsey, took money from the FDA's Center for Drug Evaluation and Research, which oversees numerous opioid-related programs, correct? You won't disagree with that?
No, Congressman, I would agree with you that we did work on, I think, what's called CDAR as the acronym for that. And it might make sense to also describe what we actually did with CDAR, because as I think the committee knows, it covers all drugs, not just opioids.
It does include opioids, though, correct?
It does. And
isn't it true, Mr. Sternfels, that at the same time that McKinsey was taking money consulting from the FDA, that McKinsey was also consulting with the opioid manufacturers, including Purdue Pharma, Johnson & Johnson, Mallinckrodt Pharmaceuticals, and also International, correct?
We work with a host of pharmaceutical companies.
At the same time that you were working with the federal government, correct?
We were, Congressman, on different topic areas.
Now, Mr. Sternfels, when was it that McKinsey first alerted the federal government to the fact that you were also working with the opioid companies?
If you look through the history of our work with the FDA in our proposal process, Congressman, we've made multiple mentions in our proposals of our experience, both in the pharmaceutical industry.
When did you first alert the federal government that you were working for the opioid companies at the same time?
I can't point to the first specific instance, but I can tell you there were over 40 references for one partner in particular about our work with pharmaceuticals, and over 20 over a period of several years that he had specific experience with opioids.
So isn't it a fact, though, Mr. Sternfels, that while your company was receiving money from the federal government, that it failed to disclose to the federal government that it was also taking money from the pharmaceuticals? Isn't that correct?
I think that's incorrect, Congressman, with respect. We made very clear that we were working both with the industry and with opioids in particular.
From day one with the federal government, you contending that McKinsey let the government know that it was also taking money from the pharmaceutical industry?
I'll figure out if it's from
the opioid industry, actually.
Yeah, and Congressman, if the first date is of interest, I'll find that. I looked for total references, and there's many, but I'll go back and get you when the first date that, and as recently as yesterday, we've seen the FDA come out on record both about the work that we did with them and our relevant experiences in the industry and in opioids. So if it's useful, I'll go back and get you the actual first date.
I'd like for you to do that. And do you believe it is proper for a private company, to contract with the taxpayers of America through the federal government for money to advise the federal government on how to combat the opioid epidemic, while at the same time taking money from the opioid industry to help them turbocharge profits? Is that right?
Sir, I 100% agree that would not be appropriate. Our work for the federal government was not specifically focused on combating the opioid epidemic. And if we were working that exact issue on both sides, that would be a conflict of interest.
Gentleman's time has
agree.
expired.